Good morning and good afternoon, everyone. On behalf of the U.S. government, it's really an honor to welcome you all to this important event with our longstanding partner, the Syrian American Medical Society. I'd like to thank today's panelists for offering their expertise. DRL leads U.S. efforts to promote democracy and human rights in Syria and around the world. This wouldn't be possible without the efforts of our incredible partners who are true leaders on this, including SAMS and many other Syrian civil society organizations. To that end, I'd like to express my sincere thanks to SAMS for hosting this important and timely discussion. We're grateful for your leadership and partnership in promoting justice and accountability for atrocities and human rights violations and abuses that continue to be committed in Syria, with a specific focus on medical facilities and workers. This year marks 11 years since the Syrian people peacefully took to the streets, calling for their government to respect human rights, allow genuine political participation, and end rampant corruption. The Assad regime met these calls with a vicious campaign of arbitrary detention and forced disappearances, torture, extrajudicial killings, and other senseless abuses and violations that continue to this day, including conflict-related sexual violence. This includes countless attacks striking healthcare and civilian infrastructure, leading to loss of life, loss of access to healthcare, and attrition of skilled healthcare workers. The regime and its allies have conducted these attacks through airstrikes and the use of barrel, cluster, and bunker buster bombs. According to the United Nations Office for the Coordination of Humanitarian Affairs, more than half of all health facilities in Syria are closed or only partially functioning. NGOs and media outlets continue to report on the regime's arbitrary detention and torture of medical workers, which is a violation of international humanitarian law. Last week marked the 6-year anniversary of the bombing of Al-Quds Hospital in Aleppo, which became known as the last hospital standing in Aleppo. And on this day 3 years ago, the Russian military reportedly bombed 4 hospitals in southern Idlib province in just over 12 hours. These are just 2 among many examples in which the healthcare sector appears to have been deliberately targeted in Syria. Thousands of physicians have been forced to flee Syria under real threat of violence and death, leaving the healthcare infrastructure decimated. Facilities are severely understaffed, and the remaining health workers must work long hours, often performing tasks outside their specialization and training. People shouldn't fear going to a hospital due to concerns it could be targeted by one's own government. We call on parties to cease all attacks on healthcare workers and medical facilities. Denying access to healthcare as a tool of war has become a hallmark of the Assad regime. Targeting civilians and medical infrastructure is beyond unacceptable. I'd like to take a moment to discuss the disproportionate impact these attacks have had on women. The conflict has threatened basic preventative care for women. Services such as mammograms and regular checkups aren't readily available, and few female health professionals remain in Syria, making healthcare even more difficult for women to find. These attacks and the consequent shutdown of many maternal health facilities threaten maternal health. The lack of access to medical facilities and healthcare professionals leaves many women to deliver their children in unsafe conditions. Fears of being attacked while at health facilities prevent women from seeking the medical care they need. The Assad regime's campaign of gender-based sexual violence also contributes to the fear of many women in Syria. The conflict's disproportionate impact on women also applies to the issue of missing and detained persons. Although women may be a minority among the 130,000 people disappeared and arbitrarily detained by the Assad regime, they suffer exacerbated economic, social, and psychological challenges due to the disappearance of their male family members. Syrian women are at the forefront of international movements calling for information on the fate and whereabouts of their loved ones. As it relates to healthcare, I want to thank SAMS for producing a new report documenting attacks on health facilities and their impact on the Syrian people, which I understand includes data about the impact on women. Such data will further inform policymakers on issues related to women and peace and security efforts. The fact that the 11th anniversary of the Syrian conflict coincided with Russia's appalling aggression against Ukraine, which constitutes a breach of the UN Charter, highlights Russia's brutal and destructive behavior in both conflicts. After 11 years of death and suffering, it's past time for the regime and its enablers, including Russia and Iran, to halt their ruthless attacks on Syrians, to include the doctors and medical professionals who work to keep so many safe and healthy. Seeking accountability, justice, and respect for human rights is a central tenet of US Syria policy and essential to building a stable, just, and enduring peace in Syria. The United States commends and continues to support the brave individuals who work to bring Assad and his regime to justice, often at the risk of their own lives. This includes the vital work of Syrian civil society organizations like SAMS and many others to document violations of the law of armed conflict and human rights abuses and violations, and to advance transitional justice. Impunity remains unacceptable. We will continue to actively promote accountability, including through support to the Commission of Inquiry, the International Impartial and Independent Mechanism, and the Organization for the Prohibition of Chemical Weapons. We also welcome ongoing efforts by national courts in Germany and elsewhere under the principle of universal jurisdiction to investigate and prosecute crimes committed in Syria and encourage increased support for these prosecutions. As their harrowing testimonies show, justice for the Assad regime's victims and their families is long overdue. The US government continues to support the UN-facilitated Syrian-led process outlined in UN Security Council Resolution 2254. We continue to call for a nationwide ceasefire, respect for international humanitarian law, and unhindered aid access through all modalities, including through the continued authorization of the cross-border mechanism by the UN Security Council. The recently released footage of the reported massacre in Tadaman, coupled with the continued death and suffering of countless Syrians, serves as a sobering reminder for why countries should not normalize relations with the Assad regime. We do not support efforts to normalize relations with the Assad regime and will not normalize relations ourselves, nor lift sanctions or fund reconstruction until there is irreversible progress towards a political solution. Our sanctions, including under the Caesar Act, are an important tool to press for accountability from the Assad regime, notably with respect to its atrocious record of human rights abuses, some of which rise to the level of war crimes inflicted upon the Syrian people. We continue to make clear that our Syria sanctions should not impede humanitarian activity or the provision of assistance to all in need. Today's discussion on destruction of the healthcare sector helps strengthen the case for accountability and bring international attention to the plight of Syrians. We're committed to working with you to place pressure on all parties, especially the Assad regime, to cease violations of international humanitarian law and abuses and violations of human rights. I'd like to thank SAMS again for organizing this important event and for the opportunity to speak with you all today. We appreciate the efforts of SAMS and many Syrian civil society organizations to pursue justice and accountability, and look forward to continuing to support this vital work. Thank you.
Thank you very much. And also thank you for the opportunity to be part of this discussion today. As Dr. Foley mentioned, I was part of the team that has tried to analyze and look at the data that SAMS has collected with regards to attacks on healthcare systems inside of Syria. And what I want to do now is really present a snapshot, given the time restraints, of the key findings that have come out of the work that has been done by SAMS. And kind of the aim of why we want to present these findings is very much to try and discuss with you and to try and encourage the fact that these statistics and these numbers and these kind of the data that you will see today, we want them to not just remain statistics and numbers and datas, but to really be used as part of accountability and for justice for people who've suffered as part of the attacks that we're going to hear about today. Again, unfortunately, I don't think what I'm going to present today is necessarily going to be a shock to anybody. The idea, as Ms. Peterson was saying, attacks on healthcare systems in Syria has become the norm. It's not a new phenomenon in conflict, but academic analysis has shown that attacks on healthcare systems inside of Syria is surprisingly high, much more comparatively to other conflicts that we've seen. And as Dr. Fadi said, this is just one organization's documentation of attacks, and it's building on other organizations' great work such as PHR, but it's just one organization, so you can't even begin to imagine the scale of attacks on healthcare systems inside the country. What we've also done with the data is we've tried to contextualize it more in a legal framework, looking specifically at international humanitarian law. And the reason why we've done this is we want to be able, for us and for anyone to read who's reading this report, to see the data in light of what can be done with the data as part of accountability. What violations have actually taken place here, and how can therefore redress be served? So we've kind of really contextualized the data through a legal analysis. That's not to say that we've kind of labeled each and every incident that we've looked at with a particular violation of law, but we're trying to show patterns, and we're trying to show, what violations of law do we see potentially could be happening in all of these incidents. So this is a picture from Al Mara Hospital after it suffered 2 airstrikes in 2017. And these are the types of incidents that SAMS have been collecting since 2014. This report itself focuses only on incidents that started being documented in 2015. That's not to say, of course, that incidents were not happening before 2015. It's just that the resources and the ability of SAMS to be able to validly document attacks and incidents was enough improved that we can validate their credibility. But incidents were happening way before 2015. And the past year and a half, 2 years, the SAMS team have been vigorously cleaning and unifying and reviewing the data and analyzing the data and verifying the credibility of the data they have of all the incidents. And comparing data with data that other NGOs have documented, etc. So this has been a long process, and finally we were able to present the data and also give it this legal framework. All in all, we have decided to focus on 674 of the incidents that SAMS has documented to try and understand the patterns and what kind of violations of law has taken place. The most poignant kind of finding that has come out of this research, of this data collection, is that of the loss of life. We've had 480 persons who've been killed just in the incidents that SAMS has documented. 56 of those were children who had been attending healthcare facilities. And in terms of injury, we've documented 1,268 persons who've been injured. Of those, 137 children. So massive amounts of immediate loss to human life. What these figures don't show is loss of human life or injury or problems caused by the fact that due to these incidents, healthcare wasn't being able to offer sufficiently after the attacks. So that's not something that's shown in these figures. What is shown is the immediate loss of life and injury that is immediately caused by an incident or an attack. So this is, of course, the most poignant data that's come out of this report. And then what we've done from there on is we've tried to frame the rest of the data with regards to 5 separate legal questions. And these are the main kind of legal questions that come up when you look at whether an incident was a violation of international humanitarian law. So the first legal question is, were there facilities that were healthcare systems that were impacted? And this is the easiest answer we have. There's so much data that show how much impact has happened in the SAMS documentation on healthcare systems. 251 health facilities have been impacted, and by that we mean like actual hospitals, and many of those have been impacted and attacked more than once. If we look also just at ambulances and vehicles, so ambulances and service vehicles, we have a grand total of 181 that have been attacked. This is a intense amount of figures that we're talking about, each and every one of these. Just amongst SAMS ambulances, 50 have been impacted since 2015, which you can imagine besides the infrastructural damage and the loss of life, how much problems and concerns that cause for an organization that's trying to provide medical care. And in terms of the impact, it's the kind of extent and the scale of the impact. 60.83% of the incidences that we recorded had significant damage done to the healthcare facility, moderate to significant, whereas 5.79% had total damage done to the facility, and 5.79% of a total of 674 incidents are a lot of facilities that have been totally damaged by an attack or by an incident. So we've got the figure in the late 60s of a healthcare facility that has been really damaged or totally damaged by the incident of an attack or of an incident or an attack. So these are the type of figures we're seeing with regards to whether an attack impacted a healthcare medical facility. Then the second question, which is a little bit more of a difficult question to answer, and that's whether the alleged perpetrator knew that the attacked facility was protected. I think it's important to kind of focus on the word protected in international law, international humanitarian law. It's not just, these are non-combatants or distinguishing. The medical facility is a protected facility. So not only do you not have to attack this facility, you have to protect this facility. And that is a really important, I think, point to take out. Of course, it's very difficult to completely come to a conclusion whether an alleged perpetrator knew that the attack facility was protected. A lot of the hospitals, for example, that were attacked in their documentation that we have were very well-known hospitals. They were well known that they were hospitals a long time before the conflict. They were big hospitals. But to really try and understand whether whether the perpetrator knew that the attack facility was protected, we can also look at the figures that we have with regards to the deconfliction process. So in response to the scale of healthcare systems that are being attacked as part of the conflict in Syria, the UN devised a humanitarian deconfliction process where the coordinates of hospitals that were providing medical care were shared with all of the parties of the conflict, so that they were not attacked, so that they were left out, so that there was no excuse anymore that we did not know that there was a hospital in that particular coordinate. Despite that, and again, this is just in the documentation that we have, 27 direct attacks took place on deconflicted facilities. We've got the list of the deconflicted facility that were attacked. Some of them were attacked more than once after their coordinates were shared with all the parties of the conflict. So this definitely undermines the fact that the alleged perpetrator did not know that that facility was protected, did not know that that facility was a hospital or a medical unit, etc. So I think looking at the scale of the amount of damage that's done to the conflicted facilities undermines any presumption that the alleged perpetrators don't know about the attack. Whether the attack, so the next question that we look at was a little bit more about whether the attack was targeted. So was this a targeted attack? Was the target the actual healthcare facility? This again is not an easy question to answer, but if we look at patterns that have come out of the data, then I think definitely raises questions of whether these facilities were targeted or not. So in the way the incidents were documented, it was identified whether an incident was a direct or indirect attack. And what that means is whether for example, the airstrike, if the airstrike immediately hit the hospital or immediately hit the ambulance, it was a direct attack. If it was 2 or 3 meters that the attack away from the hospital or the medical unit, then it was seen as an indirect attack. And the majority of the incidents that were documented by SAMS, the attacks were direct. So the target, the hospital or the ambulance was directly attacked. This pattern shows that, again, undermines the idea that these were not targeted. Even more so, if we look further into the data that we have, if we kind of go through even more detail into the data, we see hospitals that were attacked several times. If we see here, for example, El Sahur Hospital, it was attacked a total of 19 times. Again, it's difficult to see how this wasn't a targeted attack. The fact that it was attacked over and over and over again. The excuse that it was collateral damage is undermined when you see a hospital that's targeted 19 times. And then if you have time to dig further into the data and dig further into the details, this undermining becomes even more obvious. For example, specifically with this hospital was a Red Cross hospital even before the conflict. It was well known that it was a hospital. And after being attacked a certain amount of times, it went underground to try and protect it from being attacked. And it continued to be attacked even when it went underground. So again, the idea that some of these medical facilities were attacked just sort of collateral damage may be true in some cases, but when you look at cases like this, clearly there was a targeted attempt to try and attack these specific facilities. Also, I mean, the idea that the target wasn't that the target was the hospital is also a little bit black and white, because what we've seen in the documentation and in this documents in this conflict is a lot of indiscriminate weapons were also used, and that's come out very clearly from the data. So even if the attack wasn't targeted, the fact that a party, and actually a good example of this is barrel bombs. We see 84 incidents in our data where barrel bombs were used, and all of these incidents, it was the alleged perpetrator was the government of Syria. And when you use a barrel bomb, given that it's an indiscriminate weapon, you could no longer claim that you are trying to distinguish between a combatant and a non-combatant under international law. So in and of itself, using barrel bombs is a violation of international humanitarian law, because when you use a barrel bomb, you can no longer claim that, okay, yeah, I was definitely targeting a combatant or a military unit, because barrel bombs are so indiscriminate in the way they affect people. So the targeted process the patterns that we see in the data are very clear, but also there are processes of whether there's complete dismissal of trying to attempt to ensure that it's just combatants that are affected by attacks and by incidents. The next question was very much about what these medical facilities are used for. And this is a really particularly important question, because it is actually the kind of the justification given often by the Syrian regime of the government of Syria as to why attacks have taken place. So if you look specifically at the last UPR process that Syria went through, when it was asked by Turkey and Germany as to why it was targeting medical facilities, they answered that these facilities had been turned into facilities from which rockets were being launched and from which arms were being stored, etc. And they specifically quote Protocol 1 of the Geneva Conventions, that they are allowed, therefore, to target. And that is true. If it's not being used to provide medical care, it is being used as part of the conflict, then they can. So of course, this is it's a difficult question to answer, but from the data that we have, first of all, there are a lot of the facilities that were funded and sponsored by very well-known organizations, or by OCHA, or by neutral entities. But also there's a plethora of information that show that these medical units were providing medical care. We have videos, so many videos, you'll never be able to go through them all, so many pictures. And moreover, there is so much lists of what the medical consultations that were given in each of the hospitals. Here I just provided a couple of examples. At Salam Hospital, there were 7,959 consultations that month. It's broken down, and if you want more information, you can go into what the different consultations were about. And there's a lot of information that are available that could easily be used to counter argument the claim that any one of these medical units were used for anything other than medical care. Not that any specific information has ever been given. It's never been said that a specific hospital was used for this, that were available in the data and were amongst the analysis that we've been given. But even if, there's plenty of evidence to show that the medical care was being given in these. And then the final question that we went through, which again, to see violations of international humanitarian law, was that of the issue of warning. So whether, even if a base was used as a military base, or to hide weapons, the alleged perpetrator of an attack must give a warning in order to ensure that least collateral damage is done as much as possible. And the only exception to this is if the immediate rocket is about to be launched from that base. From the documentation that we've seen, the figure as to how many warnings were given before an incident was exactly 0. There was never been a warning given to any of these hospitals or units, or to anybody, that an attack was about to happen. And that in and of itself is a huge violation of international humanitarian law. This picture is from El Shifa Hospital from 2017, and it is the wheelchair of a patient who was killed as an attack on the ambulance department of the hospital. So these were the questions, and as I mentioned before, time is limited, so really it's just a snapshot of the information that SAMs have documented over the past, since 2015. Going more and more into the data, into the details, you will see more and more patterns that emerge that show that, in these specific incidents need to be investigated one by one to show exactly what violations of international humanitarian law have taken place in order for accountability to be served. I know that recommendations are going to be given later, so I won't go into any kind of potential accountability processes that we could be. So far, I mean, there have been very few. We know there's been some security resolutions that have talked about the importance of medical neutrality in the conflict. The Board of Inquiry has done some reviewing of some attacks on healthcare, but so far it's not been enough, simply. And what's really worrying now is not just that accountability needs to be done to bring justice, to bring an element at least of justice to all the thousands and I don't know, tens of thousands of people who've been affected by these incidents, but also as Ms. Peterson was saying, in terms of impunity, as we see now, the alleged perpetrator who did nearly 10% of the incidents that are amongst this data, 64 incidents, was the government of Russia. And we can see now what's happening in Ukraine, where the World Health Organization is talking about how healthcare systems are being attacked to an extent that isn't seen in conflicts before Syria and Ukraine. So this level of impunity that you can attack a healthcare system, a hospital, an ambulance, and completely have no method of accountability taking place is not just problematic for justice, but is also problematic for future conflicts and future problems with impunity. So I'll close there, and I hope I didn't take too long. Apologies if I did.
Thank you for Sam's efforts in this great work, which of course will serve the justice. So Syria's health system is one of the most fragile in the world. As you know, attacks on health, forced displacement, lack of access to humanitarian assistance, and the COVID-19 pandemic have left Syria's health system facing shortage of essential medications, supplies, equipment, and qualified staff for years. I also would like to mention also some numbers to show the high level of attacks, this time from BHR also. Out of more than 1,380 reported attacks, BHR has documented and verified 601 attacks since the start of the conflict on at least 350 health facilities. At its peak in 2017, an attack was recorded every 6 hours. Also, they documented killing over 942 medical staff since the start of the conflict, as well as systematic detention and torture of health workers. No other country has faced such high levels of attacks against its health personnel. This violence continues to have a devastating impact on lives of millions of Syrians. For more than 5 years, I will talk a little about my experience. For more than 5 years, I worked in underground hospital in Eastern Ghouta. It was underground to escape the bombing, as hospitals and medical centers have been targets of warplanes and missiles since the beginning of the conflict. I worked under these very difficult circumstances for years as a pediatrician and a hospital manager. I was in pain and felt helpless as I watched the suffering of patients and their families due to the lack of medications and many medical services. We were working in the hospital knowing that we were a target of bombing and that we could die at any moment. Oftentimes, we found friends or family members among the wounded we treated. Because of this besiegement, many patients who were waiting for medical supplies and medicines to reach them have died in front of our eyes. My hospital was bombed many times, which resulted in damage of the building, equipment, and medical supplies. In addition, we lost many colleagues from the medical staff, and some of them have severely injured. Ambulances were also a constant target of bombing. Ambulances belonging to my hospital were targeted several times, during which 2 drivers were killed and others were injured. In the last brutal campaign against Al-Ghouta, which ended with our displacement, hospitals were the first target of the regime and Russia. The violence led to the destruction of most of the hospitals and put them out of service, leaving hundreds of wounded people without treatment. For 11 years, the regime and its allies have not stopped targeting hospitals and killing doctors and health workers. all over Syria. The constant bombardment makes the people afraid to access medical care for fear of an attack. The lack of healthcare workers is a chronic challenge. Health workers have been killed, imprisoned, and forced to flee. Those who remain work without sufficient functional facilities, essential supplies, and qualified support. The impact of health system damage has left more than 12 million people in need of humanitarian support to access their basic health services. Life-saving services and medicine are often not available. The repeated attacks of the regime and its allies are the main reason for deterioration of the health system and continuation of the suffering of millions of Syrians. And despite that, it continues in full view of the world without accountability. I think the international community now must take effective and serious steps to protect hospitals and medical workers and to hold accountable the perpetrators responsible for killing, arresting, and torturing medical personnel and destroying the infrastructure of health system in Syria in order to achieve justice and rebuild the health system that guarantees access to medical services for those who need it. Thank you.
Thank you, everybody, for great presentations earlier. Well, for us, it's very hard when we hear about when we hear the stories and we see the evidence, and also when we see the inaction by the international communities. Those doctors and staff are our colleagues, our friends, our classmates. We know a lot of them. We know a lot of the ones who got killed, and we know a lot of the ones who are still actively working in SAMS and other facilities. Why we're here today, it is because we're still seeing these attacks. We're still seeing the doctors and staff and patients, beneficiaries are being targeted for many, many reasons. I'll come to that later. But every time I give a talk like this, the number of the victims is higher. The first time I did that, the number was in the mid 600. We reported in our report the number of staff got killed was 123. You have to remember these are the attacks that we documented since 2015. But other organization, and when I mentioned Physicians for Human Rights in particular, they've done tremendous work on documenting these attacks and keeping tallies of the victims. So as Dr. Amani mentioned earlier, it was the mid 900 now. So this has to stop, basically. This has to stop. We need to stop these attacks. We need accountability and justice, as Zahra alluded earlier at the end of her talk. Our response, we felt the responsibilities. Our response was on several folds. First, we activated our media and advocacy arm to talk about these attacks. We trained our doctors to document the attacks and do proper reporting, credible reports. So when an attack had happened, there's a number of a lot of procedures are being activated on the media and also on other fronts. So we report the attacks. We kind like followed report the attack. Then we followed by a more detailed report in a press release most of the time, talking more about the attacks and how it happened and when and the result of the attack. We think we cannot do this alone. Yes, we one of the most effective organization with this, but we are not the only one. Other organizations doing great work. We mentioned PHR, White Helmet. We have very strong partnership with White Helmet. We did a lot of reporting together, and IRC. And we with this partnership, with this coalition, we think we are more effective. with continuation of these attacks and continuation of loss of our colleagues, we kind of like came up with an initiative. We hope that it will be effective deconfliction mechanism. We shared after consultation with medical staff inside, with other organizations, we decided to share the coordinates of our facilities. We shared it with OCHA. That was in early March, and that initiative was formally announced during a speech that our past president, Dr. Ahmad Taraji, did at the UN Security Council meeting. Only 2 days after the meeting, our hospital in Afrin was attacked. There's a lot of information about the attack. That's why it was not mentioned in Zahra's report. I think there was a little bit of confusion. But anyway, we after that attack, I think Zahra mentioned 27 attacks on deconflicted facilities. And we also have what we call duty of care, while we cannot compensate for the loss of lives, but we try to help the families after the murder of their loved ones. But most important thing we try to do is to put our staff in protected facilities, in fortified facilities, and we have like a few models of that. So basically, the cave hospital is one model, and we know now the cave, when we can have a cave in a big hill or big mountain, it is relatively effective in protection of the staff. We have underground hospital where we have it's like a basement, or we use the lower levels of multi-level building. We have a lot of these now, these facilities, and sometimes we create a cave. So we put the building, a lot of concrete, and we put rocks and dirt over to like, in a way, create the hill. But we failed, basically. We failed as an organization. We failed as international community. We failed as implementing organization on the ground. We continue to see these loss of life of our patients. Well, what 15% of those that died in the attack are children. This is what our report's showing. So why did we fail in these measures of the protected or fortified facilities? First of all, the longer this conflict going, the more destructive weaponries are being used. Yeah, and now it's indiscriminate attacks using blind weapons, but also those long-range missiles and more destructive missiles are being used. We've seen it all over Syria. Even the cave facility, we have failed. An example is Al-Attarib Hospital. Just like a year ago, we have one of our staff, doctor, actually lost his eye with the attack. Al-Mara Hospital, at the time, I think in 2017 and 18 is another example. Another tactic the Russian forces and the government of Syria forces has used is, if they cannot destroy the hospital, they will attack the entrance of the hospital. Kafazete Hospital is a prime example for that. Was attacked few times, just the entrance. I mean, when they bombed the location itself, they didn't even feel it inside. But when they bombed the inside of the entrance of the hospital, some of the shrapnels go. My injured staff, and we've had that. I think last attack on Kafazete Hospital happened in January of 2018. We have seen targeting of medical staff as they are exiting, leaving hospitals. Dr. Hassan Al-Araj, our hero, was killed in 2000, I think it was April 2000, yes, early April 2016, from just targeting his facility, his vehicle as he was driving away from Kafr Zaiti Hospital. The other thing we've seen that was in March of 17. Actually, we've seen it more, but in March of 17, we had our hospital Al-Tamni attacked twice, was targeted twice by Syrian, and we lost Dr. Muhammad Darwish on the first attack that was on March 26th, and 4 days later, another one using chemicals. So basically, we could not protect our staff no matter how creative we can get. So when we look at why this is happening, the way I look at it is terrorizing civilians, depleting civilians from the basic needs of living, of lives. It is not only targeting bakeries and schools, also targeting facility, healthcare. So to deplete them from the access to good healthcare. So you destroy the facility, you terrorize medical staff, a lot of staff. I mean, you mentioned over 50% of doctors of Syria had left the country. But when you terrorize facility, we've seen, when you terrorize civilians, we've seen two things. I mean, one, the civilians will be scared to come to a hospital. Two, the civilians in the area will ask the hospital staff to leave. They don't want the hospital in their town or city, or because it's a risk for them. We've seen that in the hospital in Khan Safra. Eventually, the staff had to evacuate and leave. So, well, thank you everybody who worked on the report for putting these recommendations together, and the way we see it in SAMS. We have the different recommendations to different parties and entities. So basically, for the ones who are doing the attacks, we ask them to stop. We ask them to cooperate with any investigation, stop the attacks, and cooperate with entities like investigating bodies to get more information on these attacks. And the other thing, we ask them to stop this propaganda that hospitals are site for terrorists. We've seen those videos talking, I mean, on the government of Syria media. The famous one was from Al-Sakhur. I think Zahra mentioned the 19 attacks on Al-Sakhur. So after they took over the area, we've seen the video talking about the terrorists, and one of the evidence they provided was the presence of a mammogram in the facility. And the other thing, in the video, we've seen workers looting the hospital. We've seen them dismantling the CAT scan machine to take the lead, and the lead has street value. The CAT scan machine does not have a street value. It's the lead in this CAT scan machine. So for the our recommendation for the UN Security Council, we need something with teeth. Resolution with teeth. The 2254 resolution is a great start, but we need more than that. We need to broaden the board of inquiry and focus on more investigation and finding who is responsible for these attacks. We need to establish and document and call again first on attack on healthcare is a war crime, and also expand on the triple IM mechanism, and effectively help to train staff on documenting the attacks and analyze it. We want monitors, either they send monitors inside or find some kind of online monitoring system to again document the attacks, and more important, to show that these facilities are medical facilities. We want the international donors to allocate more funding to train the staff to document these attacks, more funding to put them in more protected facilities, and more funding for duty of care. So that's a little bit of financial support for the murdered family of murdered staff. We also want the international community and national donors to work with UN Security Council and its members to find a better mechanism to implement the UN Resolution 2286. For health organization, we wanted to ensure documentation of any violation of international humanitarian law. We wanted to train their staff and work with other entities, work together, work with WHO. WHO has been doing a very good job in Ukraine. So we think hopefully Ukraine will kind of give the international community a higher standard that could be applied in other parts of the world, including Syria. For the civil society, it's train your staff, help with the investigation, and work together to document these attacks. So this is where I want to end, and thank you everybody on the behalf of SAMS, behalf of Syrian doctors and SAMS staff. I want to thank you for being here today. Thank you.
Thanks so much to SAMS for holding the discussion and for a very important report. Despite all the reports on attacks on healthcare in Syria, this report has really important new information, including the number of patients killed, including children, much, much more on deconflicted facilities attacked. So I congratulate you on this report. I've worked with SAMS for many years, almost a decade, and have had enormous respect for its dedication, competence, and accomplishments in saving thousands of lives under the most difficult circumstances. Dr. Amjad said SAMS failed. SAMS didn't fail. The international community failed. You shouldn't have had to build hospitals underground or train staff and how to document attacks or protect themselves and their patients. You shouldn't have to sandbag entrances. I remember my first human rights reporting trip about Syria when I went to Gaziantep in 2014 with SAMS to do a joint report. We interviewed dozens of health workers to learn about their experiences in the midst of assault. What I heard was wrenching. Stories of doctors in the middle of an operation when an attack occurred, a doctor killed at the entrance to a new facility on the day it opened, and the work of health workers in the midst of these horrors. I also heard about the toll it took on the doctors, which doesn't get enough attention, the demoralization, the sense of hopelessness in serving their patients, the feeling that they weren't doing their ethical duty because they couldn't. At that time, back in 2014, it seemed unimaginable that these attacks would continue for years and years and years, and we'd still be talking about it in 2022. Either the war would end and Assad would be gone, or protection would emerge. It simply had to stop, but nothing was done. And as we heard, it continues to this day. In the future, it will seem unfathomable to many people that year after year, as the facts were known, the world did nothing. But to give greater context, Syria has not been alone in attacks on healthcare, though until now it's been the worst case, though Ukraine may be in that same category. In Saudi Arabia, the airstrikes by its military on hospitals in Yemen, assisted by American and British weapons, continued for years, as did the arms sales. Israel's repeated breaches of obligations to protect hospitals, ambulances, and emergency responders have taken in all 4 wars in Gaza in the last decade. In Ethiopia, in the war that began in a year and a half ago, Ethiopian and Eritrean military forces destroyed the entire health system in Tigray. Over the course of a 5-year period, from 2016 to 2020, the Safeguarding Health and Conflict Coalition found more than 4,000 attacks in that period, or a health facility attacked every other day, and a health worker killed every 3rd day. The international response has been condemnation without action. War crimes prosecutions for these acts have been entirely absent, not only in Syria, but everywhere else. A UN Security Council resolution to forthrightly address the horrors of attacks on healthcare went unimplemented. The deconfliction process did not even name Russia as a perpetrator. That's the UN process. And it took no action with respect to the finding that the deconfliction rules were violated. Now, with the war in Ukraine, the atrocities against hospitals are the subject of attention in global media. The image of pregnant women leaving a shelled hospital went viral, stimulating global outrage. The World Health Organization, mandated to report on attacks on healthcare in an emergency, but has failed to do so in many conflicts, including in Tigray, responded with alacrity. Human rights investigators are now engaged in war crimes investigations in Ukraine with support of the United States, which had long opposed cooperation with the International Criminal Court. All this never arose for Syrian health workers. So there's understandable anger at the attention Ukraine has gotten, but was never present in Syria, and nor was any action taken for affirmative protection steps like safe zones. And that hasn't happened in Tigray, in Yemen, in Gaza, or Myanmar, and many other places. But the real question is whether Ukraine and the response to it represent an enormous transformation in attention to war crimes committed against health in institutions and personnel, or will it be a blip? There's a lot of reason for skepticism. The system of international justice remains totally broken because of the veto power of permanent members of the Security Council, which will likely continue to prevent prosecutions in Syria as well as Myanmar, Tigray, and elsewhere. Even the naming and shaming processes through UN mechanisms have been repeatedly manipulated politically. Still, there are opportunities to avoid falling back into the familiar patterns of abdication and indifference. Although the structural flaws in the Security Council are unfixable in the near term, there are opportunities for transformation. The first step is for governments that are leading the charge on war crimes in Ukraine, including Europe and the United States, to end their selective embrace of norms of protection. Russia deems its Ukrainian victims Nazis, just as the Assad regime called health workers terrorists and unworthy of protection. But the United States and European countries, as well as others, embrace similar characterization of enemies as enemies regarding medical personnel. Instead of adhering to norms of the Geneva Convention, that every wounded or sick person is entitled to care, many countries criminalize medical treatment, just as Assad did, to an individual the government deems to be a member of a terrorist organization. In Europe, there's been some success in efforts to exclude humanitarian aid from anti-terrorism protections, but this does not extend to local health workers. The undermining of these fundamental norms is an invitation to crimes. Countries must also take responsibility for the Geneva Convention's requirement to ensure respect for them by not selling arms or offering military support to parties that commit breaches of international humanitarian law. Another step is for governments to put their own houses in order. They need to reform targeting and other military operational practices. They need to carry out credible investigations. They need to cease winking at war crimes by partners and proxies who they supply with weapons. The UN must also reform itself. The Secretary General must cease succumbing to pressure from powerful states to escape UN accountability or even name perpetrators. The World Health Organization must establish a credible tracking system and name those who are responsible for attacks. The UN General Assembly must step up, as they did in removing Russia from the Human Rights Council, when Security Council failure is so apparent. Finally, there must be criminal accountability. We've talked about that today. If the Security Council is stymied, universal jurisdiction must be pursued. There's only been one case in Germany coming out of Syria, and that's not enough. There must be prosecutions around the world. There are many countries that have the resources and the capacity to pursue these prosecutions, but they haven't. So we need to do that for the sake of the victims, for the sake of the norms, and as a strong warnings that the perpetrators of these attacks will face consequences. There's an opportunity to do all of these things, and it doesn't even have an enormous or even high political cost. It's up to leaders who are so fervently expressing concern and horror at war crimes in Ukraine to apply the values and commitments they tout to the rest of the world, beginning with Syria, and take the findings of today's report seriously. I think the concern that Ukraine is getting so much attention for these attacks and other countries that have suffered so much have gotten so little. In fact, even today, I'm sure people who don't pay much attention, except hearing the news, don't even know about the attacks on hospitals in Syria for a decade. But we know there are reasons. It's Europe. It's Russia with one of the strongest armies in the world. It's about white people. There are so many explanations. But I think what we have to do is say, I think as Sam's and others are saying, is we have to extend the concern. Yes, it's terrible what Russia is doing in Ukraine, and it's done it before. It's done it in Syria. It's done it in Chechnya. It has to be a moment where Ukraine forces a transformation. I think that's the only thing we can do in response to the feeling of abject neglect and even racism in the international community. We have to transform that. As to Russia not being invited to the Brussels conference, you always want someone inside the tent, not outside the tent. But there does come a point where you have to take a stand. And I think as a matter of principle, that stand has to be taken. Same with removing Russia from the Human Rights Council. It cannot participate in the G20 or the Brussels conference or other international forums as though it were a normal country. And frankly, I don't think it's going to have a big effect on the Security Council decision on cross-border aid, which we haven't talked about a lot, but it's so important as it comes up in July. It's already been problematic. And I think the Ukraine, the exclusion of Russia from the conference and other international bodies is not going to have a huge effect. Russia will do what it does. It's already blocked cross-border access in most of the crossings. And I think that the risk has to be taken that exclusion could further exacerbate Russia's resistance to cross-border aid. I think it's a risk that has to be taken.
The problem with, not problem with this question, the problem with this concept is that the burden is really on the NGOs here. Where, you know, like Mr. Rubinstein was saying, you know, when Dr. Amjad was saying we failed, it's not the burden of doctors to be trying to protect a facility, or burden of doctors to try and on nurses to be documenting. So what the NGOs should be doing about dealing with the deconfliction, I think, is not relying on the deconfliction list, to not presume that once that you know, coordinates of a hospital that has been shared means that the hospital is protected. I don't know whether there is potential for the deconfliction list or the deconfliction process to be strengthened. I think the fact that there has been no accountability for the fact that the facilities on the deconfliction list have been attacked and targeted probably means that, and you know, Russia has withdrawn, probably means that I don't know if there's any potential for its impact to be strengthened, or whether there should be much more energy and effort by NGOs put into this. I think it's personally, and I don't know if people agree with me, I think it's better to put effort and energy into other mechanisms and other accountability processes. And looking at potentially looking at Ukraine in a way, not comparatively, but looking at the opportunity that Ukraine puts forward in terms of, you know, is it possible that maybe Russian commanders in chief are going to be taken to prosecution, how we can utilize this alongside our Russian counterparts. So I think putting our energy into other things and not how to deal with the deconfliction list is my own personal opinion, because clearly it wasn't very productive according to the data.
Thank you, everybody. Thank you.